Is that because a lot of those treatments are less based on the scientific method and are more culturally based?
So I think they're based on the scientific method, but they don't look at the mechanism in the same way that we do. So if we look at scientific method, what is scientific method? It is having a hypothesis, testing that hypothesis, observing results. So I think they did that. That's not how meditation was developed, which is a whole different conversation about sources of transcendental knowledge and all this good stuff. But they absolutely applied the scientific method. So I don't think that you can develop as robust of a system of medicine. The big difference, though, is that we're really good at instrumentation. So in the West, it's not even technically a part of the scientific method. You can just, a child can make observations, test hypotheses, and come up with conclusions.
I mean, every time a child's learning to walk, that's what they're
Absolutely,
doing.
right? But they don't use a microscope. They don't understand anything about anatomy. So one of the things that I think we've actually mistaken is that in the East, they use the scientific method quite robustly. They just don't use instrumentation. So what they did is figured out all of these correlations and causations and developed these kind of heuristic systems. Even something like the concept of an organ is actually an abstract concept, right? It's not, you can make an argument that there's no such thing as an organ. There's just, everything is just cells.
You can just say that about anything, about a cell.
Yeah, right?
That's like, I feel like Deepak Chopra's main thing is like, what is HIV? That's a concept that you've created in your mind. It's like, well, wait, hold on a second.
Yeah, so I'm not
I think
quite
it's very
there.
easy to go.
So I think they applied the scientific method, but what they didn't have was good instrumentation to elucidate the mechanisms, right? So they didn't have microscopes. They didn't have, but they were still able to make observations that when you have a diabetic, they're going to have sugar in the urine. And if you have sugar in the urine, you can test for that by if ants drink your urine.
Right. I think a lot of their scientific method approach is more so finding correlations and things that happen, which can be a form of scientific method and an introductory form of scientific method. But then in order to see if your correlation is valuable, can you affect it? Can you reproduce it? Can you generalize it? That is always missing.
In Eastern medicine?
Yeah.
I disagree.
Really? So tell me more about that.
So that's how they came up with these things like ashwagandha and brahmi and some of these things that we use in psychiatry, turmeric. So for example, the usage of bitter herbs in the treatment of diabetes. So what they did is, I think, right? So I wasn't there. You just have these texts where they'll say, okay, if you've got someone who's a diabetic, they need to eat bitter melon. So I think what they discovered is that when you feed someone a food that has an impact on their insulin metabolism, has an impact on their blood sugar, once this person eats bitter melon twice a day or drinks the juice of a bitter melon on a daily basis, the amount of sugar in the urine that the ants get attracted to goes down. They'll even taste urine to detect the sugar content using their tongue. And then I think they see that this leads to better outcomes over time. So I would not call that a correlation. I think at some point in the system of medicine, what you always have is an intervention, and then you measure that outcome in some way.
I guess to me, unless you randomize it and control for biases, it's not that.
That's a huge problem. But in the opposite way. So here's the key thing. So when you randomize, so we view the RCT as the hallmark, right? There's a huge problem with the RCT. So let's say I show you an RCT that says that cholesterol, let's say like cholesterol lowering medication. What is the outcome for an individual patient when you prospectively give them a cholesterol med?
You're talking about number needed to treat.
No, I'm not talking. Oh, yeah, sure. But so if I come to you
that
today,
like 99% of the time for the individual, it's not going to have an impact. But for the general population, you will see.
So this is really important to understand. So our system of medicine does not make predictions about individuals. It makes predictions about populations. So Ayurvedic system of medicine is completely different because they don't care about populations, they care about individuals. So their whole system, so if you think about randomized controlled trials, what we're literally doing in that trial is removing the individuality from our system of medicine, which then creates a problem of external validity. So the basic problem of our studies is that we can do a study on 10,000 people, but you know this as a clinician. This is why we need clinicians, because your human brain needs to take all of this data and then translate it to apply it to an individual. So in the Ayurvedic system of medicine, they think that randomized controlled trials are the antithesis of practicing medicine.
Can I explain why I heavily disagree?
Yeah.
Well, I agree with first of all, the notion of why we need clinicians, of taking generalized concepts and individualizing it to the person in front of us, 1,000%. And I think that's what my residents get wrong the majority of the time. I just did a video on this because the idea of number needed to treat, just why I brought that up, is because it's a topic where, for example, lowering blood pressure, we see population-based, controlling it to a certain number will prevent 30% of heart attacks and strokes. But for the person sitting in front of you, 98, 99% of the time, it's not going to do anything. So the question of why I still, the reason why I think randomized controlled methods are still the best for the individual is because we're throwing out the baby with the bathwater.
What does that mean?
We're throwing away randomized controlled studies because they're imperfect to the individual. I think we need to look at it deeper and say, right now, this is the best knowledge we have for the general public, which will ultimately be the best for you because this is the best information we have.
Okay, so this part gets really, really long and gets moderately dense. I think that anytime we are stuck in a conversation where two really, really, really smart people seem to just be at a complete freaking gridlock, we need to just take a step back as listeners, right? Because ultimately this podcast is for us, right? And so I encourage us to take a step back and think, what is the point of all this? Like, what am I taking away from all of this? And when you start to do that, you'll start to see like meta points that I think are equally valuable as the points that either of them are individually making themselves. So like, you know, Dr. K is a big proponent of like, hey, let's look at the individual and then extrapolate that to the population. Well, not a big proponent, I would say, but he's like, there's merit to that approach. And Dr. Mike is much more staunchly in the camp of like, you know, the only way to do something well is to look at it from a population base, even if it doesn't trickle down very well to the individual. We'll keep doing it, and eventually you'll get there. So what I'm actually taking away from this conversation is not whether or not Dr. K is right or Dr. Mike is right, but more so, what does this tell me about science? And what this tells me about science as we consider it today, and the scientific method of evaluation and exploration and, you know, this, that, and the other, as we consider it today, are, again, man-made constructs, right? Like, depending on a very specific goal and a very specific definition of what is better for humans, we determined levels of hierarchy of evidence and why RCT is at the very top. If you have a slightly different take on what is ultimately good for humanity and good for people and medicine, you might put a different kind of form of study at the very, very top. It just sort of depends a little bit on your goals. And again, like, it starts to get into like a very philosophical space, but I think that sometimes we fall into this trap of thinking that science is superior as we define it in modern times, because without realizing that, like, if you really get into the nitty-gritty of science and the scientific method, there's a lot of nuance, there's a lot of art to it. A good example of this is I actually sat down with a physician friend of mine who has a lot of experience analyzing medical research. So he was the one who actually introduced me to this concept of levels of evidence. And what he ultimately revealed to me, a layman, was, you know, sometimes we think that it's like, oh, something, a certain intervention or certain drug has been through clinical trials, and therefore it's good, it's proven, it's perfect. But like, and however, it has some side effects. But that's not really the right way to think about it if you actually look at it. At the end of the day, especially a lot of times when we don't understand the precise metabolic pathways of something occurring, we can't actually say that something works, period. Because something works, period, would imply that it works 100%. And really, all that we're getting to through clinical trials is getting us to a certain degree of confidence that this is going to be good enough and work for enough people in terms of outcomes of treating specific symptoms, and the side effects are tolerable enough that we can quote unquote safely release that out into the world. So as you can see, there's a lot of room for interpretation there. And it's really interesting because you look at something like birth control for women versus birth control for men. So hormonal birth control for women, for any women or others who have had women in your life who have been on hormonal birth control, or, you know, non-women, whatever. Anyone who's been on hormonal birth control knows that there are like a ridiculous amount of side effects, and some of them are like insane. Like, you become almost a different person because it affects your mood, your energy, and all these things so much. And sometimes they're good side effects, like clearing up your acne. Sometimes they're really bad side effects, like draining your energy completely, right? And so like that was deemed as acceptable side effects to actually release the drug. But then they had studies in recent years, clinical trials, where they were trying to test hormonal therapies for men. And a lot of men started complaining about the same ailments as women, in terms of skin changes, in terms of mood changes, in terms of just like all these like nasty things that they didn't enjoy. And they actually were like, you know what? This doesn't work. Like, the side effects are intolerable. And so already that reflects a certain degree of kind of bias, not just in terms of whether or not this thing actually works, which again comes down to a percentage of confidence rather than saying that it works or it doesn't work based on modern day scientific methods. But also when you look at something like side effects, we don't have the resources to go and investigate all the metabolic pathways that result in all these different side effects. So a lot of times we don't actually have explanations for why certain side effects occur with various drugs. And so I would say that there's like very much, I would say, gray areas when you get really, really deep into scientific methods. And so I would encourage us as the general population to just kind of keep that in mind when we're thinking about what we consider truth, right? Again, the weird thing is everything I feel like that you try to get really precise and really scientific with, at the end of the day just ends up being like some of an art and with a bit of philosophy when you get really, really deep. That's what like a good friend of mine who is a PhD in chemistry and is doing a lot of drug research right now tells me. It's like when you get really, really deep, you consider science, like chemistry, for example. A lot of us who've just taken high school chemistry might think of chemistry as such a precise science, right? Math in the same way. But if you ask really top tier mathematicians and chemists who are like the top of their field, they will actually claim that there is a lot of art and philosophy and just kind of like, we don't know what's going on, but we're kind of like figuring it out to how things happen and how we understand things and how we approach science when you get to that upper echelon of like research and development. So I think that if we zoom out again as a meta point, it's like, I think it's useful, this debate that they're having, because it raises the question of what is science, what is the scientific method, and therefore what is truth. Because to a certain extent, if there is even an ounce of subjectivity and an ounce of artistry to the scientific method, then by definition, truth will ultimately have a certain degree of subjectivity to it. And I know that is a really crazy meta point that is probably burning your brain, and you did not ask to have your brain burned like when you watched Inception. But all that is to say, in a very tangible sense for us, is I think it's important to keep an open mind, right? And not just say, just because XYZ hasn't gone through the tests, a very specific set of tests in a very specific set of ways doesn't always mean that it is wrong. Doesn't mean that it won't work in practice. And on one hand, like Western medicine, quote unquote, dominates, like Dr. K said, right, verbatim. I would actually argue that it's also insane the extent to which complementary medicine is dominating. If you go on social media, a lot of people are searching for treatments to their ailments. Why would so many people be searching for treatments to their ailments like arthritis, infertility, hair falling out, like muscle spasms, like all these different things, when we have doctors today? Why? It's because we are in pain. A lot of us are in pain because the drugs that have been approved through, let's say, RCT or other types of, research or trials, etc., aren't always working for us. And so therefore, how do you define something that works? Something that makes one symptom goes away, but then gives you all these other side effects. Is that really the definition of something working? So I think the biggest takeaway is just to be a little bit more open-minded, because if you don't, you could actually inadvertently miss out on a lot of quote-unquote truth. You could miss out on the realities of some of the pitfalls of the scientific method, of RCTs, of Western medicine, and you could miss out on some of the benefits of Eastern medicine and its approach to the world, right? Ultimately, I think we as humans, our ultimate responsibility to the world is to take really good care of ourselves. And if we can do a better job of taking care of ourselves by being more open-minded to different tools that could potentially be useful in our toolbox, then as patients and as people in the world, I think that is the most important thing. So we can continue to let Dr. Mike and Dr. K battle it out. It's really fun to watch. But for me, it's like, why not just explore and get the best of both worlds?
So I'm going to keep track of it. Individualism, stratifying personality types, cognitive fingerprinting, as you called it, and then diet, lifestyle, I guess, is one of them. It seems to me, based on this conversation, Ayurvedic medicine is fraught with a lot of bias issues, et cetera, that you pointed out, reliability, all that. Since so much of it is inaccurate, and there's a few things that you think is very valuable that are missing from modern medicine, why not take the concepts of those things, like improving the cognitive fingerprinting of modern tools, focusing more on the individual approach, and stop calling it and talking about Ayurvedic medicine? Because it's sexy to talk about Ayurvedic medicine because people are passionate about it. But 90% plus is crap. And yet I feel like we're keeping it afloat.
Well, I don't know that it's crap, and you don't know that it's crap.
Well, we know that it's crap because of how it got to where it is, because of the lack of reliability, the randomization.
We don't know it's crap. We just don't know that it's not crap. There's a big difference.
And when someone makes a claim that this water will prevent you from dying, or this is the anti-aging water, do you know that this is not going to prevent you from living forever? Like, do you know that I'm lying about this?
No, I don't.
Right? You need to do a trial. But I'm very comfortable as a doctor now saying, no, that's not happening.
Yeah.
Because mechanistically it's not there. The evidence isn't there. And I've gotten to the point where even though I don't have the evidence.
So Mike, what frustrates you so much about Ayurvedic medicine?
I'll tell you why. It leads to a fundamental misunderstanding of healthcare for a large percentage of patients. It opens room for health gurus and hucksters to take advantage of people. And it actually diverts our attention from ways that we can improve medicine.
Okay. So now I'm understanding this conversation a lot better. So I noticed that this was becoming very antagonistic, which was really weird because I actually agree with the majority of what you're saying.
I see that.
Yeah, right. So I'm the first to kind of say, like, I'm the one who said, hey, like 90% of it I think could be crap. And so I was kind of struck a little bit. And then that's when I realized, like, I'm not talking to someone who has an open mind. I'm talking to someone who has a mind made up.
I'm talking about it from a truth-seeking perspective. So my mind's not made up. If you presented some data or information here that showed Ayurvedic medicine is way more accurate than you think it is, I would have changed my mind today.
Yeah, so it's interesting, but I think
I definitely have a bias.
Yeah,
from what I've learned so far.
How is this conversation for you emotionally?
Exciting.
In what way? So do you feel anything besides excitement?
Full excitement that we're finding a way to truth seek together. Because unlike many people who talk about Ayurvedic medicine in this space, I think you do it incredibly honestly.
So, because I agree with you, but I think there are a couple of things to keep in mind. So when you make a statement like, 90% of it is crap, that indicates bias to me because we don't know that. You make a very good argument that we have to be skeptical based on our understanding of things. That if I show up today and I say like, oh, like, here's a pyramid. If you meditate under the pyramid, like it could work. And then you can always make the counter argument that until you study it, we don't know, they could be right.
Right.
And what I'm also detecting from you is like, I think I'm detecting this emotion of frustration because of hucksters and these kinds of people. So I think your understanding of Ayurveda comes from these people. And so that's why I was kind of surprised because usually in conversations, I am representing your view a lot more.
Yeah.
Right. So I'll go to these academic conferences with a lot of Ayurvedic practitioners and I'll say like, hey, like we don't know. There are 8 disciplines of Ayurveda. We have some limited evidence of this particular thing, Brahmi, turmeric, ashwagandha, like a set of herbs. We don't have a whole lot of stuff on this. And so I think it's just been really interesting. Now I understand a lot more why this conversation is going the way that it is, which is that you're asking me all these questions, which I get the sense that you're sort of open to the answer, but I think you're asking questions that are not open-ended questions. You're asking questions where you already have a hypothesis, and you are asking me to reflect upon that hypothesis or even counter that hypothesis or support it.
That's fair.
So this is probably the most referenced part of the podcast, bar none, in the comments. And the reason is because they had sort of like broke the fourth wall moment almost. Well, not really. It's not like they started addressing the audience, but you get what I'm saying. They both took a sort of a step back where Dr. K was just like, bruh, you mad, bruh? Dr. Mike's like, no, I'm not. And Dr. K's like, I don't believe you. But when we're listening to this podcast, again, ultimately we want to bring it back to ourselves because it's for us, right? That's the most important thing. I think that it is very... So this is Dr. Mike's channel. He has, a bias and a point of view. He himself admitted that. If you actually read the chapter titles, it's very telling. The chapter titles are Risks of YouTube Medicine and Mental Health Stigma, Mindfulness and Enlightenment, Ayurvedic Medicine Texts, then The Weaknesses of Ayurveda, Why Ayurveda is So Popular, Why I Don't Like Ayurveda, The Advantages of Ayurveda / placebos. So like, it's a very, even if you read the chapters that Dr. Mike's team has established, there's a certain slant to it that's a little bit anti-Ayurveda. And I think even though there is this bit of a slant, and even though a lot of the people who are watching this are probably, because it's an English or probably kind of a Western audience, if you read the majority of comments, they're actually pretty open to what Dr. K is saying. They're not saying definitively that I agree or disagree, but they're saying, this made me think, and I'm now becoming a little bit more open-minded, and I can kind of see both sides. Whereas typically if you have a conversation, you know, in this sort of audience, Dr. Mike's audience, it might be pretty like pro-Western medicine, right? And I think one of the reasons is because of the chi of the conversation. Let me explain that. So again, chi is a metaphorical concept. You have to realize before you ding something in Eastern medicine or Eastern philosophy to be right or wrong, you have to understand just the degree to how much of it is a heuristic, a metaphor. And in this instance, you can think about chi as sort of like the vibe of the conversation, right? Chi represents energy, things that move, that are like non-physical. And so if you listen to the vibes of the conversation, I think the reason that Dr. K is able to create a certain degree of resonance or even a certain degree of open-mindedness amongst this very like pro-Western medicine audience that Dr. Mike has on his channel is because of the way that he's approaching the conversation. He's very willing to say like, there are points in which you say that I agree with, now let's build off of that together in terms of exploration. And he's able to, for the most part, I would say, keep his cool pretty well. There's one part, the part where he tickles Dr. Mike's foot. I would actually argue that that is much more than a semantic. It is much more than him saying, where does thought come from? You know, let me tickle your foot and show you real time what stimulus is. It's, I think he's recognizing from his clinical practice that Dr. Mike is still getting a little bit worked up and he's still like caught up, maybe it's like his amygdala is firing, right? He's caught up in this very defensive, like attack kind of stance to this conversation. And he's saying, let me ground you a little bit and bring you back into a bit of levity, a bit of physical sensation in your body to help get you out of that thinking brain and panicking brain, right? Into a more kind of like balanced state. And so it shows a certain degree of Dr. K's ability to navigate the situation with a degree of, I would say like influence, control, but also perspective. Because when Dr. Mike, from my observation, when Dr. Mike is approaching this conversation, it's very him against the enemy of like what he considers falsehood or dangerous to the general population's well-being. Dr. K is taking the perspective of, hey, let's have a conversation, but also he's observing the tonality of the conversation and how the conversation is going, and he's calling out when it's starting to feel antagonistic or he's not giving a fair chance because he's being asked very pointed questions. And so he's able, and he's also helping both of them, I would say, like navigate that challenge together to help bring the conversation to a place where it is a little bit more neutral setting, right? So he did that both through trying to like tickle Dr. Mike's foot. I don't know that that's like the strategy that I would always take. Like, you know, like if I'm in an argument with my boss, I'm about to start tickling his feet, I'm just saying. But like he's recognizing when Dr. Mike is being worked up. He's calling it out in a very, I would say like, almost like friendly way. He'll say like, instead of, hey, I'm noticing you're being antagonistic, he'll say, I'm noticing this conversation is having an antagonistic feel to it. And so there are things that he's doing that represent his ability to kind of be present in a way where he doesn't get so triggered that all he's, because what happens when people get triggered? When people get triggered, you go like this. You go zero in on the enemy, the threat, the fear, whatever. But he's able to manage his own emotional state in a very difficult conversation. In a pretty good way where he's actually able to also see from outside of himself into the vibes of the conversation and help kind of navigate that and help and also be and hold space and recognize what, you know, Dr. Mike might be feeling and have that conversation explicitly about it in a way that's, I would say, like friendly and appropriate. And so like obviously a lot of that is because of his training and, you know, this is what he does professionally, but I think that's also a little bit of a testament to this concept of chi, right? And in this case, I'm not talking about the vibes of the conversation anymore. I'm talking about Dr. K's qi in and of itself. Like his qi is fairly powerful. And again, I'm taking a Chinese medicine kind of lens here, where qi again, applied to different contexts means different things. It can represent a person's sort of essence and being. And when you seek out doctors, you want to find someone who has good qi. This is why I talk about in my channel, like if you go to an Eastern medicine doctor, like feel the temperature of their fingers when they check your pulse. Look at the state of their complexion, the way they talk. Are they calm? Are they collected? Are they put together? Right? Do they look healthy? Kind of almost to diagnose your physician in and of themselves. Because there is a philosophy in Chinese medicine that if you're going to be a healer, you need to have really good qi, because you're going to be dealing with shitty qi all day from like poor patients, right? And that is both representative of like their kind of mental state. When I say their essence, it's their mental state, their quality of health, all of which are interlinked. And so I think there's a certain degree of quality of strength and power in Dr. K's qi that he has cultivated. And that in and of itself is something interesting to note, because that creates, to me, a proof point that like maybe there's something to what this man is saying, right? And this is where, you know, and so like, So I think again, one of the best ways for us to get the most out of this conversation is not just to pay attention to what's being said, but how it's being said, what is happening, and if you zoom out, what does this mean for me, right? What is it saying about society? What is this saying about where we are in terms of macro influences? What am I observing that might not be spoken?
So there's this concept of parampara, or lineage, where like if you had a good teacher, like, and now things have changed, we can get to this with meditation. So you had this lineage where like you basically have like a system of mentorship where if you trained under this person, you're like going to be good, because this person would not let you out unless they were good. There's still problems with bias there, but I think the biggest challenge that we've had in Ayurvedic medicine is we've lost some of their fundamental safeguards like lineage. And then we've replaced it with like standardized education, because that's what we do in the West. And so now we have a system that from its bones is open to things like validity, open to things like not being critical of itself. And then we are removing the one safeguard, which is this concept of parampara, or lineage. Now we're giving people degrees and certificates from universities. I have no idea how to tell whether someone is good or bad. And what I have seen as a medical doctor, like part of the reason that, you know, I studied Ayurveda, fell in love with it, and then I went to medical school. Because what I saw is that I have no idea what's the quality of education I'm going to get. I have no idea what's the what the reliability of some of these methodologies are. I've seen things that are medical impossibilities from Ayurveda. With my own eyes, I've talked to patients that are medical impossibilities, like paralysis, being able to polio paralysis, right, which is a permanent condition. That's not something that, generally speaking, gets better. These people are able to walk.
I would say another critique that I would have, maybe not critique, but more like word of caution that I would have for anyone who is interested in trying Eastern medicine, is beyond what Dr. K just talked about in terms of lineage, or just like, it's very hard to tell if a doctor is actually going to be good or bad. Because I'll give you an example, something like reading your pulse, right? There are like 20 to 30 different types of pulses in Chinese medicine. But how do you know that this person is so skilled that they are doing a good job of accurately categorizing your pulse? You have literally no way of measuring that, because it's not a test, it's not a blood test, it's not a chemical blood test, it's a literal, the test is someone else's 3 fingers on you, and depending on how they were trained and how good they are, and like honestly the state of their health, right? This is why I think it's really important to have a doctor who has good qi if you're gonna, and just interact with people who have good qi in general. It's like, if they don't have good blood circulation at the fingertips, or their thoughts, their mental health is not good, so their thoughts are cloudy because they got anxiety or whatever, they're not going to get a super accurate read of your pulse, right? So I think what that means for us as humans is, yes, you should explore Eastern medicine because it is a low cost if you approach it the right way. Again, like things like cupping, things like gua sha should cost you almost nothing. A lot of herbs you should be able to find cheaper ways to get it. If you have any questions about that, leave a comment below. But it's a very low cost, low side effect way to try something new for your health. But I think the thing that you should keep in mind is, one, you are probably going to want to try more than one doctor because the quality of the outcome is very doctor specific and you may or may not get the right doctor the first time. I'm actually thinking of building a database of top ranked doctors based on Chinese social media for Chinese medicine doctors in America. So I find that to be a little bit potentially more accurate because, you know, Chinese people reviewing it, they have a lot of experience with Chinese medicine. But there might also be a little bit bias towards having more Chinese doctors in that system. So anyway, if that's something interesting to you, let me know. I can help build that. So that's like one thing is you're probably going to have to try more than one doctor to really get a feel. And I would try, you know, different types of doctors. The second thing is the quality of herbs has gone down substantially over the years. So that actually has a real impact on the quality of outcome as well. So for example, a lot of the medicinal properties of herbs in traditional Chinese medicine are a result of the very unique conditions in which these herbs grew, right? A lot of them were wild herbs. So they were part of these like wild climates. Maybe they were in a cave for like hundreds of years, or maybe they were part of like this very specific riverbank soil, like, you know, by this river or something that had like a very specific kind of like mineral composition, or like all these different very specific conditions that cultivated in this being such a potent herb. You can think of it the same way as like, you know how apples all taste like apples, kale all tastes like kale nowadays, but if we actually look at the nutritional value of, let's say, an apple today versus an apple like hundreds of years ago, it's drastically different. Like we have significantly less nutritional value in our modern food supply today because of the depletion of soil, because of the way these things are grown. It's literally in and out because of factory farming, etc. And so the same is happening with herbs. Like a lot of herbs aren't wild herbs anymore, and they didn't even have the same amount of time to grow to the full potency of the chemical makeup. And so that has an impact on the quality of the outcomes you're going to get. So I think there are quite a few caveats to keep in mind when you're entering into the world of Eastern medicine, just the same way as there are a lot of caveats to keep in mind when you're entering the world of Western medicine, right? There's a lot of traps and pitfalls with like insurance, with like also the quality of the drug supply, unfortunately, with how much lobbying, how much politics and commercial interests are behind the different drugs that we're taking. I mean, like a big scandal came out recently with McKinsey really recommending that opioids be pushed harder by pharma reps to doctors, and really encouraging the overprescription of opioids because it was going to be more of a moneymaker. And that's a very, very common thing. Like I have a background in strategy consulting, and I've also worked with very, very large pharma companies as well. And I can say that like a lot of insurance, a lot of the way that, you know, even physician practices, hospital networks, pharmaceutical companies think from the perspective of money. Like patients are seen as customers and not so much patients. And so there are reasons why certain drugs are developed. Certain drugs are developed because they make more money for people, right? They're able to charge a higher cost for them. Or maybe they're going to create, you know, they're never going to say this, but they're going to create a certain set of side effects that Like if I developed another drug that was side effect free, like maybe I don't want to do that, right? Because that creates more drugs that I can sell. Or maybe this drug could cure you, but let's stick with the drug that only manages your symptoms. Like all of that are very real things that I have seen with my own eyes in the healthcare industry. And so like, again, there's the philosophy and the thought and science behind both systems, but then there's also the realities. And I think as people and as patients, ultimately our prerogative is to be open-minded and be clear-eyed and have kind of like a critical evaluation of everything to make the most rational decisions for ourselves, right? Where I have elevated intellectual conversations with complementary and alternative medicine practitioners, because I think that it's pretty hard to find quality conversations. I would say almost produced like Andrew Huberman, Chris Williamson style on the internet. One of the interviewees that I have coming up in a couple months is going to be with someone who is doing research in this space and applying statistical analysis to Chinese medicine. I think that would be a really interesting one to listen to if you find this kind of stuff interesting. So drop a follow.